Hey everybody, it's Alan. So in this video, I want to tell you about my consultations about metoidioplasty surgery with Dr. Schafer or Safir at the Brownstein Crane practice near San Francisco, and also a consultation with Dr. Chen in San Francisco that I had just a few days ago. So this video is only going to be about my general impressions of the doctors and my experience talking with them. I'm going to make a separate video with the actual information that they gave me about the surgery. Alright, so my first consultation was with Dr. Schafer at Brownstein Crane, and I hadn't heard a whole lot about him beforehand. Like, I've heard blogs and stuff from like two people who had met with him. So I didn't quite know what to expect, although he has very good credentials. Like, he has lots of experience with like urology surgery and stuff. So, okay, so I went to Brownstein Crane practice, and that is where I had my top surgery, so I'd been there before. And, so my impressions. The receptionist or nurse or whatever she was nice, but not like, it's not like she really chatted with me or anything. And I didn't have to wait too long, which was good, because when I've been there in times past, I've had to wait like forever. So after waiting a little bit, the nurse took me into the room, and she just didn't say much at all. She was like, well, sit down and he'll be with you soon. And that's really all that happened. And so then I waited for a while, and Dr. Schafer came in with a woman who was a physician's assistant, I think, and so she just kind of stood there and observed the whole time. So I talked with Dr. Schafer. Well, in the beginning, actually, he kind of launched into a spiel about like metoidioplasty versus phalloplasty, and I was a little bit put off by that because he didn't ask me like what my priorities were or what I already knew or what questions I had. He just kind of started talking, which was a little odd. And so he said a couple of things that put me off a little bit. Like, I think he was trying to say that he understood that lower surgery was important for the sake of my gender dysphoria rather than doing it for the sake of other people or something. But he said, like, well, you totally look like a guy, and people would never think that you weren't just a guy, and so you've done well in that respect, or something like that. And so that was, like, you're not supposed to sort of like compliment a trans person on how well they pass, because then that is sort of implying some sort of like something negative about trans people who don't pass as well. That was weird. And then another thing he said that put me off later on in our conversation was, so I had asked him if he thought that my bad scarring with top surgery, which I've shown you guys in other videos, if that would mean that I would be at any higher risk for any complications with lower surgery, like higher risk of stricture with urethral lengthening. And he said that I would be at a little bit higher risk for a stricture, which is when the new, like, lengthened part of the urethra sort of tightens up as healing happens and as scar tissue develops, and you can end up needing a catheter or something if you just can't pee enough through the new urethra. But he commented that something to the effect of, well, you know, you're a trans guy, and if you've thought enough about the surgery to get to the point of, like, having a consultation or wanting to go through with the surgery, it's not like a slightly higher risk of a complication is gonna put you off of it, so it's not really anything that you should bother thinking about. I mean, he didn't use those exact words, but that was his message. And I was quite put off by that, because it's my body, it's my choice, as the saying goes, and I am going to judge what will or won't stop me from getting surgery. So I was not happy that he was sort of making the judgment for me, or, like, just assuming that, like, it was sort of pointless to tell me about increased risk of complications. Very presumptuous, so I was rather turned off by that. And, okay, just a couple other things. Let's see if I can make a long story short. Okay, it was odd that, so he talked to me for a few minutes in the beginning, and then he and the PA stepped out for me to take my pants off and put the little drape thing over me so that he could see what I had to tell me how good a candidate I was for metoidioplasty. So I was sitting there with the little drape thing for way longer than necessary, like, I don't know, at least a good 5 minutes before he came back in. And so then, like, it was the deal where I kind of, like, had to, like, lay back and, you know, have my feet up and stuff, so that was unpleasant. He was fairly quick, but he also didn't seem to be that sensitive, just in general, overall. Like, you know how if you've been to a OB-GYN exam, they'll often say, like, okay, you're going to feel my hands in such location, and okay, next I'm going to touch you here and do this. So that's out of, like, respect and stuff, and so you don't freak people out. But he was, like, already touching something. He was like, you're gonna feel my hand, and then he was like, you're gonna feel, and he was, like, mumbling. I could hardly even hear him, but he would say the things, like, as he was doing it, which kind of defeats the purpose. And so it's not like I care that much about the, like, moves being announced. It's just that, like, if you're just purely going through the motions without really doing it properly, it just shows sort of a lack of sensitivity, pretty much, and I was a bit put off by that. And, okay, so then after the exam, he and the PA stepped out again, and then I got dressed, and then he was going to come back and I would ask more questions. But he was gone for, like, at least 10 minutes. And I was like, what is he even doing? Like, is he seeing another patient? And it was weird. And so then he came back in, and I asked my questions, and I didn't feel comfortable really while I was there. I just felt stressed out, just because nobody was really especially warm, or just the whole thing seemed very distant and detached, and I mean, I know that stuff like that does not necessarily have any correlation to the surgeon's skill, but in order for me to trust a surgeon and for me to, feel okay going through the surgery, I need to be able to feel like I can trust them and to feel like I can feel comfortable asking them questions or raising concerns. And I didn't feel that way. Like when I was sitting there for like 10 minutes or whatever in between, I almost had this like urge to just get up and leave, just like sort of run out the door, because it just didn't feel quite right. And I was feeling like physical sort of stress and anxiety. And okay, so next I had my gigantic list of questions, which you'll hear about in the next video. And so the whole time that we were talking, Dr. Schafer was like at the far side of the room, kind of sitting, leaning against the counter, and I could never tell if he was quite making eye contact with me. It was weird. It was as if he was looking like a centimeter away from my eye or something. It was like he was almost making eye contact, but it was just weird. And he did answer my questions, although because I was feeling kind of stressed, I didn't really like ask every question that I may have wanted to ask. And he would kind of like sort of look at the PA and like smile at her a little bit in this way where he thought it seemed like he was kind of giving her a look like, oh, isn't it amusing that this guy has so many questions? Or like, wow, that's a lot of questions. So, I mean, I don't know if that's what he was actually thinking, but the point is, just with all that, I came to the conclusion that I just didn't really particularly want to have anything more to do with him. So, yeah. Now, in contrast, the following day, I had a consultation about metoidioplasty with Dr. Chen in San Francisco. And I had met him before, actually, at a conference kind of thing, and I had already good impressions of him, and that was just confirmed. Like, the receptionist was really friendly, and the nurse was really friendly and actually talked with me and actually did stuff like take my blood pressure, and she was just very kind. So I felt good being there. And then Dr. Chen was really warm and friendly. He sat kind of close to me and was like looking at me and was just friendly. And he, just the details of the things he said, I could tell that he was really knowledgeable about and sensitive about gender dysphoria, and I could tell by the terminology he used and stuff. So I felt very comfortable with him, and I felt comfortable asking all my questions, and he answered them, and he gave kind of more nuanced information than Dr. Schafer did, and he told me some things that Dr. Schafer didn't, and I'll tell you about that information in my next video. And so yeah, I just felt like he was patient and really listening and really caring and also really knew what he was talking about. And just in case you're interested, so for the exam part of it, instead of having me, like undress waist down and put the little drape thing on and like lay back for the exam, all he did was have me like stand up and kind of drop my pants, and then he kind of looked at me and fiddled around for like 15 seconds or something, and that was it. So that was less stressful than the thing with Dr. Safir. I mean, I want the doctor to do whatever he has to do to properly see what he would be working with so that he could give me the best information, but Dr. Chen just did that faster, and he observed all these things in like 15 seconds, and then so after had my pants back up again, and we were talking, and I was asking questions. He told me about this observation and this observation and this observation about what I have down there and how that would affect metoidioplasty. So I was really impressed. And, he didn't like go in and out and make me wait for 10 minutes or something. And also, so with Dr. Safir at Brownstein Crane, when the appointment was over, I had to go ask the receptionist lady, like, so what do I do now? And then she was like, oh, so, well, somebody will call you in 5 to 6 weeks and talk about scheduling if you want to schedule. So first of all, it was not ideal that I had to go out of my way to ask, like, what happens next, and also that if I did want to schedule with them, which I don't, I would have to wait like a month and a half to even talk to anybody about it. That's weird. I don't know if that's because of the insurance process or what, but with Dr. Chen's office, at the end of our talk, he personally asked me, like, so what do you think? What do you want to do? And I said I didn't feel ready to pull the trigger at that time, but I did tell him that I would definitely go with him if I do decide to go through with it. And so then the receptionist who I was talking to afterwards told me that he is going more towards starting his own practice, because right now he's in like a partnership practice with a urologist who sees cis men, or at least that was my impression. So in a few months he's going off by himself totally, and so it sounds like he manages like most of the emails and phone calls and stuff, and the receptionist was amazed at how he managed to have time to do all that. So it seems like he is very hands-on with dealing with the patients and communicating with the patients, which if I were a doctor, I would not do that, because I'm sure it's really overwhelming in terms of time. But he just seems really committed and really caring and attentive. So, and also, like I said, he was just very warm and friendly and made me feel very comfortable. I did not feel stressed when I was in the office like I did at Brownstein Crane. So, yeah, I feel really confident with Dr. Chen in terms of his knowledge and experience, and just the fact that I would be able to ask him questions and speak up for myself and not feel super stressed about doing so. So, there you go. I'll bring this to a close, and then my next video will be about the actual content of what we talked about in both of those consultations. All right, feel free to let me know if you have any questions, and thank you for watching. Bye.